Get my screen. I'm gonna get my screen shared and then we're going to start and getting it all into there. Let me get this into an actual presenting state and we're gonna be good to go. All right, so this is gonna be our professional development training on our LGBTQ plus identity. So for some course introduction, for kind of what we'll be learning here today is getting an understanding of our LGBT plus cultural history, learning some about the data, the demographic data related to this community, and gain an understanding of the transgender experience that can really help you understand how a lot of our trans individuals may experience kind of what they are going through. I think, okay. To introduce myself and kind of the work and what I bring to this work is that I am the state expert of North Dakota for our LGBTQ plus outcome data. The reason that I am the state expert, the reason I say that is because I am the person that dedicates their time to tracking the data within our youth risk behavior survey that's done by CDC and used to be done through the DPI, but will be done through the Health and Human Service starting next year. I also look for and track the data with our behavioral risk factor surveillance system, and we'll actually be talking about a little bit of both that later in this presentation. But I spend a lot of my life looking at data. I try to find it both on a national lens and a local lens. And I am a North Dakota born and raised woman who loves North Dakota data. So I really, whenever I can, I try to put our state data up there and talk about what's going on for our kids, for our adults. How do we improve outcomes for our population? So that's something I always bring to the work. I have a lot of different backgrounds. I've been doing this for about 10 years, providing training like this. I got started in nonprofit work, and then throughout my kind of career, I started doing more healthcare-based work. I started a clinic that treated trans individuals called Harbor Health Clinic, and then kind of shifted into Canopy Medical Clinic, which is currently a women's health clinic that does a lot with equity work. We work with the state government for doing things like the Ryan White programming for individuals living with HIV and AIDS. And generally, we do a lot with sexual health, reproductive health, and LGBTQ plus health. So I have a strong clinical background. I get how clinics work inside and out. And a lot of people that do more equity work don't get that. So you're not going to see me telling you, here's 30 more things you need to do in the hour you have with a patient, because I understand you're very busy. I also have a lot of experience working with general, like I mentioned, nonprofit. I try to keep track of all the data going across our state, but I also try to find out where there are affirming places for support and opportunity. The main lens that I see my work through is going to be suicide prevention. So virtually everything I do is going to be through a lens of suicide prevention in one way or another. I'm doing a 3-part series. This is part 1 of that. First part here is going to be about demographics and getting into that. The second part is going to be about organizational improvement. And the third part is going to be about that suicidality component, since that's something that I am the one that really tracks that across the state for our LGBTQ plus population in general. So that's kind of my introduction and the introduction to the training that we have here. I talk quickly, like that's something I'm just going to do. Personally, I always talk like this, but it's also because I always have a lot going on and there's a lot in this training I want to get through. I'm going to aim for about 5 minutes at the end. If we're really lucky, it'll be 10 minutes for kind of more of a Q&A or discussion piece for some of this. But there is going to be some built-in opportunities to engage. And I will kind of denote how you can do that when those opportunities come up. But with all the people we have attending, I'd probably just ask to, if I ask you to do something, probably put it in the chat or we can communicate that way. So those are my housekeeping rules as we get into my training. So some basics to get started is terminology and definitions. So we've heard the word transgender. I think some of us are hearing what the word cisgender is lately, but what are these words? They're very simple. They're basically a prefix added onto gender. And what is that prefix? That is trans. It is a Latin for opposite side of or out of alignment. Someone who is transgender means their sex assigned at birth is the opposite of or out of alignment with who they are. If they were assigned male at birth, they identify any way else, they could be considered transgender. Cis is Latin for same side of or in alignment. Lately, the word cis has been under attack in some circles as being a problematic word. Cis is Latin. It's been around for as long as Latin, which I think many of you may know is a while. So that's how we understand the word cis. It's used in chemistry pretty often, but it's also used as just a prefix in a lot of spaces. When we add cis to the word cisgender, it means someone's a sex assigned at birth matches or is in alignment with who they are. If you were assigned female at birth, you identify as female, that's in alignment, you'd be considered cisgender. And the last word here is queer, and that refers broadly to anyone who is not straight or cisgender, the word I just helped define for you. So queer is a really important word that can help basically convey you're part of a marginalized community without exactly saying in which ways. Telling someone you're a trans woman is really private, intimate details about your life you may not want to communicate to someone. Telling someone you're a lesbian is the same way. But trying to communicate you're part of this community and just say that you're queer can be a way for a lot of people to, be able to identify and own that without communicating really specific things about their sexual orientation or gender identity. Um, some people who are older may have understood the term queer to be a pejorative, I can't say that word, wow, to be used in a bad way. Or considered like a slur, but that really hasn't had that same connotation in the last 20 to 50 years. There are people who don't like that word, and if they say, please don't use that around me, you can honor those wishes, but this word is so sterile that it is syndicated. Like you have queer eye for the straight guy. National television is not putting a slur in their title of a thing that they want people to watch. So this is a safe word to use. Usually use it like queer studies, queer lens, queer theory. Um, so those are ways that we can understand some of these basic terms. I'm gonna assume most of you understand what gay and lesbian means. And if not, I will recommend Google for that. But one of the things I really want people here to know when I talk about these words is that they are demographically important. And that means I don't care if you identify as trans or cisgender, you don't have to. But demographically, you're going to fit into one of those categories, and it is demographically important because the experiences of people who are cisgender male are going to be consistent and different to experiences of cisgender females or transgender males or transgender females. Even if you were to assume that a trans woman is, let's say, biologically male, and that might be similar to someone who's assigned male at birth who could be cisgender, they have vastly different experiences. Even on a biological lens, if a trans woman took hormone therapy, her risk factors for so many different things will be different than a cisgender man's. These are demographically important words because you will be getting different outcomes within these populations. So a lot of times when there is some pushback with the terminology here, it's about, identity reasons, but from a healthcare perspective, these are really important words to include in health demographics and surveys. Like we need this information because it's statistically different and relevant between trans individuals and cisgender individuals, depending on how they identify. So when I talk about that throughout the course of all my trainings, keep that really in mind. I want to talk about queer narratives here because I think that we have not had a lot of time to really process all these things that we now know about queer identity. I am in my 30s, in rising. I keep on getting older. And when I grew up, we didn't talk about queer things. When I grew up, I don't think 30 is considered very old by many people. I think that's still very young. So when I grew up in my high school, there was one openly gay kid. There's only one kid in my high school who felt safe enough to be out. This was in Fargo, so one of our places that you would think would be a little bit safer for this stuff. There were definitely a lot more gay kids. There were definitely a lot more trans kids at the time. Only one felt safe enough to be open about that, so the general school knew. This was now 20 some years ago, but even today, there's a lot of folks who really don't know anyone in their life who might be gay or trans. This is still new to people. They've only had 5, 10 years to talk about this stuff, and that's tough. Even people who are trans, even people who are gay, they've had to deal with this and think about it and process it for 20, 30 years before they can really start to understand what it means for them and how they interact with other people. So if it's hard for someone who's living those experiences, you have to understand it's hard for a lot of people who aren't to really understand what these things can mean. Um, hopefully, can, 1 second. Okay, I should be good. All hear me? We're good? Okay, fantastic. If I touch my microphone, it gets temperamental, and I accidentally touched it. So the transgender tipping point was something that came out in 2014. That's only, well, that's 10 years ago now. I've been doing this training a while. It used to be 2 years ago, then 5, and time keeps on moving on. So that was 10 years ago, or 9.5 at this point. But historically, not that long ago. We had Janet Mock's book, Redefining Realness, that I don't know the exact publication date on it offhand. I think it was late 2000s, early 2010s, if I'm not mistaken. But this was one of the first books talking about being a trans kid. Like, this was one of the first times we actually got to see stuff like that before Jazz Jennings became more of a national name in trans youth. But there wasn't access to this when I grew up. There wasn't access to this when a 25-year-old grew up. In a lot of ways, we are now all kind of learning this generationally together. And I think that's worth understanding when you engage with this topic, is that we are all sort of learning together what these things mean, but whatever generation that you might be right now. So let's talk about some of the ways that we think about this. And this is personal reflection, so I want you to think to yourself about some of these ideas I'm going to bring up. How old were you when you first heard what it meant to be gay, bi, or transgender? And you can think this to yourself, and that is, just what age were you when you first heard or understood these things? I can tell you personally, for me, I first heard the word lesbian. I can't tell you my age. It was like 8, 9, or 10. And I heard it when my parents were talking about a mutual friend of theirs who had come out as being lesbian. And the way I heard that conversation was, I thought she got a disease and I thought she was dying, because they were talking about it in such a solemn way, like her life was over and she would have to leave her family and all these things. And as a 9-year-old, I was thinking, like, I was conflating with being a leper. And as a 9-year-old, I didn't know what that meant either. So I'm like, okay, being a lesbian is just like a kind of being a leper, and you have to go to like a leper colony or a lesbian colony. Like, these were ways my 9-year-old brain was thinking about it. And that's how a lot of these conversations happen when we first heard about it. I was 9 or 10 when I first heard about lesbian. I didn't hear about transgender until I was 19. That was the first time I ever heard that word. And for a lot of people, in the last 5 years might have been. But how old were you when you first heard these terms? Keep that in mind. It's going to be different years, but keep that in mind, because this next question is related. How old were you when you explored or determined what your sexual orientation or gender identity was, if ever? Did you ever think, I might be gay, I might be bi? Do you ever question your gender identity? And how old were you when that happened? Was it when you first heard these terms when you were 9 or 10? Was it when you first heard them when you were 15 or 20? Was it never? You've always been very certain with who you are? Like, there's diverse answers to this. There's not a right or wrong answer to any of these questions. I just want you to think about this. And this last question is going to tie these two together. And it's going to ask you, what was culture like, or the opinion about LGBTQ plus people during these moments in your life? Because if I thought I was a lesbian when I was 9, then that meant I thought I had a disease and I would have to leave my family. Those are thoughts that would be connected in my mind if I really knew what that meant, and I didn't as a 9-year-old. When we associate a lot of negative characteristics to certain identities, when we start to think if we apply to those identities, we can reject that in ourselves because we don't want the negative stigma associated with it. And when we think about being trans or gay, or if that applies to us, and we think about all of the negative ways that will ascribe to us, we might not want to embrace that. And keep that in mind. I'll be exploring what that can mean a little bit later in this presentation, but this is just kind of your own personal reflection. So for this one, let me double check on something. Okay, I should be able to do it like I think I can. So this is called a raise your hand exercise. So what you can do is you can raise your hand as part of a feature in Zoom if you want to participate in this. You do have to lower your hand. It doesn't lower automatically, so keep that in mind. But I would like you to raise your hand if you could participate in this. Have you ever seen a source of media that talks about transgender people? And you can hit the raise your hand feature. I think I can do it too, and I won't compromise anything. Recognize hand gestures. I think we can, yeah, we got hands raised. Fantastic. We're raising hands. Everyone's doing a good job. Good job, everyone. In the presenter mode, everything looks a little bit different, so I don't know where my hand raise happens to be. So even if you can't participate in that, you can also just like say yes in the chat. That's completely fine. But I want you to think about that because I'm going to ask you another question, and that think about the source of media that you engaged with. And you can put your hands down now and you might raise them in a second, but think about the source of media that you last saw. So it could have been a book you read, it could have been a newspaper article, it could have been a TV show, it could have been anything. Think about the last time you remember hearing about it. And I want you to think about that piece. I want you to think, was the author of that piece transgender? Was the director of that show, the actress in that show, the writer of that article, the journalist, whoever had that creative control, were they trans? And if they were, put your hand up or put in the chat, yes, they were, or I believe they were. And if you don't know, the answer probably is no. So feel free to take a second to think about that, or like rapidly Google up to see if if it was a trans person or not. I'm not seeing much in terms of hands up right now or chat, which is what I expect, honestly. I usually get about 5 to 10% of participants to keep their hand up in that part. So with 16 people, that's, one or two might have. Within 100 people, I would expect maybe 10 folks to raise their hand. And usually they're people who are, following trans media pretty routinely and probably engage with authors a little more routinely. There's a lot of ways that can play out. But I wanted you to just kind of keep that in your head. And then for the next question I have is there a trans person in your life? And don't put your hand up for this. Don't out people in your life. I should preface that. Is there anyone in your life who's trans that is a family member, a friend, a colleague, or acquaintance? And honestly, when I ask this question, I don't care about a trans person. What I mean is there a trans person that you would hug if they're sad? Or any way that you would typically express support, whatever way is normal for you. And would they hug you in return? Like, do you have that kind of relationship with someone who is trans? And that could, it doesn't have to be the closest friend in the world, but a friend, someone who's in your life. These are other things to think about. These are all just things that I want you to think about as we talk through some of these other lessons I'm going to go through, because we have to ask ourselves what informs our perception. A lot of people think they come to these topics with a blank slate and they're like, I am going to logic my opinion about these issues completely with rational, logical neutrality. That's how people think about it. And that's not really how humans work. So in 1934, there was something called the Hays Code, and that disallowed any positive representation of LGBTQ plus people, and that lasted for 30 years. And this was mostly within movies, but basically you couldn't have any positive portrayal of queer people within the movies for 3 decades. If this wasn't your life, and it probably wasn't, it was your grandparents' life or your parents' life. And there were some ways to find positive material, but not in North Dakota. Like, you weren't finding like some bootlegged queer positive thing in the 1950s here. Like, maybe you were, but there's no historical accounts I know of about it. I would love to find that, honestly. But there wasn't a way to see positive stories, and most of the stories were negative. If there was if they were allowed to be like, a gay couple, it had to end tragically in some way. Like, the moral lesson built into these stories was it was wrong and bad to be gay. That lasted for a generation of people. In the 1980s, we had the AIDS pandemic rampaging both the LGBT plus community in garnering significant cultural backlash. So I work with current Ryan White clients, individuals living with HIV and AIDS, and AIDS stigma is still prevalent. We still have laws criminalizing that in North Dakota that did not get overturned in 2023. They had an opportunity to decriminalize it, and we chose not to. So it's still highly stigmatized. But in the 1980s, it was even worse. And it was ignored, it was stigmatized, and to be gay was effectively culturally considered a death sentence. So you had a lot of parents who were really scared, because not only if their kid came out as gay did they maybe see that as morally wrong, they saw it as their kid was a couple of choices away from death. That's how parents saw it, and there was a moral panic that really made people scared and terrified. And I can't cover all the culture. This is really just a broad strokes of some things, but all kinds of like underground cultures had to develop to create any kind of community or safety, including specific like messages on barns that would say you are safe to come here, because kids were running away from home because they couldn't compromise their own gay identity with their parents' rejection of it and the violence they could experience. This is the 1980s. This is 40 years ago. This is yesterday in terms of cultural relevancy. This just happened. If you did not grow up in this time, your parents did. I grew up in this time. The 1980s is part of my life. And going into the 1990s, when I was actually like growing up, like that conversation about a lesbian being, a leper, it makes sense with years of exposure to this idea that it's a disease or it's wrong or it's awful. And I want you to revisit your own understanding of this when you thought about if you were gay or lesbian or trans and how culture could have impacted how you might have rejected that in yourself or others. This was about 40 years ago, and the impacts still affect us today. Not only was a cultural stigma there, but like a worse thing is hundreds of thousands of largely gay men died, and a lot of them gay men of color. They aren't here. They didn't spend the last 40 years educating folks, developing like networks of safety and all the things they could have been doing to make our culture today better than it could have been now, because they died. So we lost a generation of elders. We gained a generation of moral panic, and that leads us into a lot of the problems we have today. In 1998, Matthew Shepard was killed, and that sparked national attention to LGBT+ rights, especially youth. History is not 3 data points. There is 1,000 things happening in between all this. Stonewall is a big part of that. But I want you to understand that how our perception exists today was created by something. And 25 years ago, this happened to Matthew Shepard. And I feel that that tended to be a turning point where we started to say, this is too much. The pain, the trauma, the suicidality, the violence, like, do we want this? Is this protecting kids? Because it wasn't. And we started to make a lot of changes. And early 2000s, when we started to see things like Trevor Project come up, and we started to see a lot of effort to start to protect kids as opposed to ostracize, discriminate, and otherwise set them up to fail. That's a timeline in our culture. And we grew up in this. Like, that gay kid wasn't safe to be gay in my high school in the early 2000s. Like, and today, even though we feel like we've gotten so far, a lot of these kids still aren't safe. So if we look at trans individuals, that's looking at largely queer community, but trans individuals in particular have a shorter shelf life. And that is, we did a media study from 2002 to 2012 from GLAAD, who basically studies media representation. And they found that in that 10-year time frame between 2002 and 2012, only 12% of storylines featuring trans characters are groundbreaking, fair, or accurate. 88% of the stories were not groundbreaking, not fair, or not accurate. Most of the time, trans individuals in media were portrayed as sex workers, and that's all you ever saw them as, either sex workers or victims of sex crimes. And if that is the only way you've ever engaged with trans media, it can kind of make sense when you see laws targeting trans folks as being obscene or things like that, because they didn't portray what it was to be trans. They portrayed this strange mythologized idea of it. But that's how people understood transness, was through media, because they didn't personally know trans people. Looking at research into that, in 2008, 92% of the people got their information about trans individuals solely from media. They didn't know anyone who was trans. They just trusted the stories they saw online or on television. And even going to today, or 3 years ago, 2 years ago at this point, in 2021, 58% of people still get their information about trans individuals solely from media. You can see how that might distort the perception of what it is to be trans. And when I ask you the question is, did a trans person write that and no one could raise their hand? So often these stories are not written by trans people, but about trans people, where they philosophize why trans individuals are doing X, Y, or Z, or they insinuate ideas or agendas into certain behaviors or actions that aren't honest. They're not full of integrity. They're just fluff pieces sometimes. But a lot of our perception about being trans is really flawed. It's over sensational. It is misinformed in so many ways. But since folks have been their entire life getting these messages from the time that they were born in maybe the 80s, 50s, 60s, 70s, 80s, 90s, whenever you're born, to today, there have been these quiet things informing our perception the entire time. So take that all together and let's look at how many individuals identify as queer by our generation. If you look at Gallup poll in 2021, we see 0.8 for our traditionalist as older generation, and then 20.8 for our younger generation. So Generation Z, not Generation Alpha, don't know where they are yet. But the point being is you do see like a doubling every generation. And you can find that there are people who look at these numbers with alarm and they say, how did we get so high? How is this number so big? How did it's now 20 times what it was 80 years ago. Is Generation Alpha going to have a 40% LGBT plus community? Is 2050 going to only be gay and trans people? Like, no, but this is kind of like the projection alarm that people have. And whenever I see people discuss this, it's almost always this lens of, what did we do wrong? How do we stop these people from thinking that they're queer? What's causing these people to be queer? Is it influencers on YouTube? Is it culture? Is it the water? What's happening here? And what they don't do is they don't reflect on what was causing so few people to come out in these older generations, because we have a lot of adequate explanations for that. We have the Hays Code for this generation. We have the AIDS pandemic for this generation. And this is a generation born during and subsequently after Matthew Shepard was killed. And when we started to actually have support and visibility for people who are queer, there is so easy of a way to explain why so many more people would be comfortable coming out today compared to back then. But the biggest mistake I see people make, and it's really awful for me as a data person, is thinking there's a right number. There is not. If this number is 30 next year, okay. If it was 10 next year, okay. I don't really care. What I care about in my work is, do kids feel safe? That is the core and only question I care about. And if that means 30% of kids are coming out as queer and they feel safe, fine. 10% they feel safe, fine. We have to determine that these kids are safe and can adequately communicate what's going on in their life. That's what we care about. So those are some things to consider with why we have so many more queer youth today than we maybe did a generation ago. There are a lot of ways to explain that. And going into it, another way to look at it is left-handedness. I'm kind of a hipster. I was sharing this kind of data way before it became popular, but now everyone does. But it used to be a thing where left-handedness was about 2% of the population, and now it's about 10%. And the reason being is we stopped forcing everyone to be right-handed. More people were naturally left-handed. When we stop forcing everyone to be a certain way, there is more natural diversity within the systems than we can expect. There wasn't a lot of left-handed national influencers in the 1920s that made kids think it's cool to be left-handed. You just know. You're like, it just feels better to be left-handed, and I want to do that. And if you can, you will. I don't know how much time I have. Sometimes I talk about left-handed can openers because they're amazing. If you're left-handed and you haven't used a left-handed can opener, I recommend trying to get one. However, they're expensive because left-handed people get exploited because it did mark up those products so much. I don't have to get into any of that, but I wanted to. So if we look at it globally, another thing we like to talk about is a lot of people have anxiety with these topics, and they have conclusions they've emotionally gone to, and then they find intellectual reasons to support those conclusions. And sometimes they look around the world and try to say that historically we never had queer people. That's sometimes an argument you get. Or they try to bring some kind of natural biologicalism into it of this is how people should be. But when we look at the history of cultures, the PBS Two-Spirit Map is a very fantastic resource. It's easy to find, you can Google it. And every one of these bulletin points that you're seeing on my screen, if you were to click on it, this is a screenshot. It's not an interactive like thing, but it can be if you're there. It's a culture that has had more than two genders. And the more that we research into different cultures around the world, the more that we find there was gender diversity. The word transgender is not going to be like etched onto a stone tablet somewhere. But the ideas that we convey when we say transgender, gender discongruence or gender dysphoria or cross-sex, like wishing to be a different sex, we have always seen that. That has always been part of humans. There are some cultures that have been more patriarchal and more strict in gender roles. You'll find that too. You'll find cultures that have only had, really strong gender roles to them, but you'll find just as many cultures that have had more than that. If you click on the ones in United States, you get Two-Spirits, which is a pan-Indigenous term referring to a broad way of gender identities being expressed between different tribes, and just showing kind of the historical relevance and diversity that exist even within our nation. So there's so much to the history, and it's really fascinating if you actually want to look at it, how people have been portrayed. And we kind of tend to learn more and more as years go on and find more discoveries of diversity existing through all of recorded history. It's not a new phenomenon. Some of the words that we have to describe it are modern, but they're not new. If we look at the actual demographics, William Institute, it's kind of the bread and butter place to go for LGBT plus demographic data nationally. So it's where I've been going for a long time. And if you look at the state population for North Dakota, for our adult population, they put us at about 0.5. So with our estimated population, that puts us about 28.4 thousand. However, as people here may know, we did gain 5,000 people in North Dakota, and our population record went up a little bit. I don't know if anyone here is into census data jokes, but I got them. You just do data so much, you have to play around with it. Anyways, I wanted to make a few points about this. When I first started tracking this in 2015, North Dakota is one of the lowest states with data in terms of how many queer people were here, and especially queer youth. And when we actually measure it, we tend to be on the lower end. I don't think it's represented here, but I'm pretty sure this is least to highest. So I think North Dakota is tied for the 5th lowest population percent. That's not accounting for our state population. Like it's just total population amount. So we tend to be the least within the nation for that. So that's something to consider. A lot of our queer adults don't want to stay in North Dakota, and statistically, proportionally, we have less of a queer population than average, and that's something that we can see in the data. When we're looking at the Youth Risk Behavior Survey, what we find is that for our youth in particular, about 4 out of 5 of our kids are straight and cisgender. So straight meaning not gay or lesbian or bi, cisgender meaning they're not trans or gender diverse, like definitionally I described at the beginning of the training. What this means is about 1 in 5 of our kids are probably LGBTQ plus, but the data is a little bit different on that. So I say about 1 in 6 of our youth are probably lesbian, gay, bi, or diverse within gender expression. About 1 in 25 of our youth are probably going to be trans or gender diverse. When I say that, we're not thinking about a kid who's like, I want to get on hormones and I want to do all that stuff. We're thinking about a kid who's like, this sex that is assigned at birth is, I don't like that. So it doesn't mean someone who's necessarily going to medically transition or cares about that. It just means they could be non-binary or see themselves in a different lens or a different way culturally or the way they express themselves. In terms of transition, so individuals who are more considerate for medical treatment, we would have about 1 in 50 of our youth within North Dakota. These are broad approximations, and for trans individuals, our data is always going to be weaker just because they're such a small part of the population. And to understand this is to understand that you need 50 people for one trans person to show up in your demographic data, just by statistics, meaning that even if you have 10,000 individuals participating in a survey, you're only going to get about 200 trans people. So finding large amounts of trans individuals for survey data is always a challenge. The thing I want to talk about here, though, is that it ebbs and flows. So you do find a higher percentage of middle school students who will identify as LGBTQ plus. It's about 20% compared to high school students, which is closer to 16 to 15%. And I think this makes sense. And I think this will probably, I can't say for sure, but I think it'll actually probably be consistent that way because middle school students, these are students going through puberty and they're trying to figure out what's going on and they have a ton of hormones going through their systems. It's a confusing time for anyone. I think it's going to make sense that a lot more kids going through puberty or in middle school are going to be exploring these things, going to be identifying in different ways. And I think by high school or college, they're probably going to have a better idea of, I figured it out. I think this is what's really going on. So I personally believe, I can't support this with data right now, that we will always see kind of a higher amount of identity in middle school and a little bit less in high school and probably through life at that point. But that's what we're seeing right now. I can't say if it'll be a trend that keeps on going or if it'll stabilize. But basically, we're thinking about kids. Only about 80% of our kids are strictly straight and cisgender. This is all from our Youth Risk Behavior Survey. That's 2021. Yeah, 2021's data. 2023's data will be out later this year, so we don't have that yet. But I always look for it, and I work with our data experts that normally do these systems to make sure I have the most accurate data. So I work with the people who, do this for our government or for our school systems, so I'm not making any mistakes. Here's a brief rundown of our behavioral risk factor surveillance system data. I'm still getting this data ran by one of our state experts that does this, but I just want to show you that we do have this data and we are starting to measure it. So this is data asking specifically about our gay and bisexual populations. The BARFIS is interesting because about half the respondents of BARFIS are like over 50. So it is much more favorable to older generations in terms of what the data is suggesting. So the BARFIS does look like it shows a really smaller LGBTQ plus population, but that is due to a older generation being the primary respondents of it, because older individuals are less likely to have come out as being LGBTQ plus. Those are just some things to consider with it. I'm not going to go over all these like data points. I kind of just wanted to let you know that it exists. The other thing I wanted to talk about in particular, because I think it's funny, is that the data suggests that the wealthier that you get, the less bisexual you will be as a woman. That's a correlation causation. Like, it's not real, but if you look at it down here, it shows that prevalence of bisexuality is 12.9, 13, 10, 8, 4 compared to the income they make. And the reason that shows up as a kind of funny quirk in the data is because the younger you are, the less money you're probably likely to make. And the younger you are, culturally, the more likely you are to probably identify as bisexual or part of the LGBT plus community. So if you wanted to interpret this data incorrectly as a joke, you could say that bisexuality is related to poverty. It's not. Like, don't go in there, but it's just it's a funny data thing. If you spend as much time with data as I do, you need to find some humor in it. So data aside, let's talk a little bit about labels and what you need to know about labels. And that is specifically, I think in a lot of traditional trainings like this, a lot of people are primed and expected to sit down and get explained exactly what, transgender means, exactly what bisexual means, or pangender, or all these different terms and labels. And I used to do that. Like 8 years ago, my training was pretty typical, but I did like evaluations into it, and I found out that wasn't productive for two reasons. One is that the terminologies are always changing. If I were to tell you what every definition meant today, it could be 3 weeks from now, three of them are wrong because they've changed. Like culture, there's a different way we understand them. The other is that I found out when I was giving these terms and definitions, professionals would write them down and then they would start tuning me out and then be like, I figured it out. I have the definitions of these identities. I'm good. If I have a trans person coming into my office, I'll look up my notes, I'll read what trans means, and I'll know who this person is. And that's not helpful. So I've actually gotten away from doing that. And I will say that if you do want like textbook definitions of what we consider these labels to be, I have a link down here. It's GLAD reference LGBTQ. This is a pretty good reference material for it. But what I want to tell you and what you need to understand is that you do not have to be an expert at labels. You do not need to know what everything on this screen means. I don't. I don't know what everything here means. I maybe know what like a third of the stuff on this thing means. Get comfortable being uncomfortable with this and just saying, I don't know. Tell me what that means. If we're thinking about behavioral health, if we're thinking about therapy, we're thinking about a client coming in and saying, hey, I'm demigender. You don't need to sit there and go, I know what that means. Yeah, I'm cool. I'm hip. I'm down with the lingo. You don't need to do that because you need to understand what it means to them. And that is going to be different for every person. If a person tells you they're trans, you might think, okay, I know what's going on here. You might not. When I was 9, if I told you I was a lesbian, you'd be like, that's okay. But I would be saying, I think I'm a leper and have a disease. It's important for you to know that when people identify, it's going to be unique and different to each person. How they understand, how they use these labels are always going to be different. And when you ask someone, that's awesome. What's that mean? How do I make sure you feel safe with that? And whatever way makes sense and however way you communicate, it lets a person know that you care. And it lets you actually understand what these labels mean to them so you're not making incorrect conclusions. You could have a kid who's 12 come up and say, I'm trans, and you could start to get really scared and go, okay, this is a lot to deal with. We have to figure out this and that. We need to, whatever. And that kid might not know what trans means. They might be using it in a different way than you expect. They might have completely misunderstood the term and they actually just mean that they like presenting in female things, or there's 1,000 different things it can mean. So don't focus on labels, don't focus on definitions because it's not going to help you. You need to focus on people. You need to focus on what they tell you, ask them what it means, and go from that. It's okay to have a background repository of some of the knowledge so you're not completely lost, but I really caution not trying to put those labels first and not trying to put them over a complete person, and rather talk to them, ask them what it means, because it's always going to be a little bit different. This is really important in healthcare in particular, because we have clients who are identified straight men. And then if they tell us that, we're like, okay, they're straight men. I'm going to ask some questions about their sexual partners. I'm going to assume they're women. I'm going to assume this is their risk factors. They could still have sex with other men. They might just not identify as bi or gay because of all the stigma associated with those terms. They could actively be having sex with other men and talk about it and still consider themselves straight. When we make assumptions based on labels, we stop trying to recognize certain things about people. And it's important that you ask them not just, hey, are you gay or straight? You ask them, what's your sexual history? What kind of partners do you have sex with? Like this would be a medical intake and stuff like that, but this is how I kind of think about and frame it. It's the same way for any way that you're doing intakes like that. It's just, you have to let them lead those conversations in whatever ways that you can, and you do not need to be an expert at labels. The really good thing is if you work with a younger client base, they get it. Like they get you don't understand. Like a lot of kids, if they are interacting with someone who's like 50 or 60 or something who's doing some of this work, like they understand you're going to have a harder time using they, them pronouns. They understand that you're not going to be hip on the lingo that they have or the ways they refer to it. But if you are compassionate and you really let those kids know that like you care about them, you're listening, you're trying, you want them to be safe and, love their life, they respond to that. Like that's what they usually care about. So I really try to get people to be less anxious about labels and less anxious about getting everything right and really just focus on people. Focus on the things that you can communicate to them because that's going to build your trust with the clientele and that's going to build your rapport and it's going to build your knowledge too over time. Every expert that I know in this field in North Dakota, they're not an expert because they started out amazing or because they went to some class that taught them how to be an expert. They just were receptive to getting better, and over time, they became amazing. If anyone here has a goal of becoming amazing, it's time and effort. That's all you need to get there. You do not need to be a perfect expert at a lot of these things. So we're going to talk about some of the biology aspect of it. I work a lot with the medical care system. I worked with a lot of doctors who provide this care and have done a lot of training through a lot of our different training institutes. So the first question I ask, and this is something you can enter into the chat, how long have we been treating trans people with hormones in America is my question. How long have we been doing that? And you can enter that into the chat. And you can take a guess. There's no penalty or wrong answer, but I do like to play with the Price is Right rule. So the closest without getting over is the one who wins. And if you win, you get to kind of celebrate yourself and be like, yeah, I won. And you can talk to your like coworkers, hey, I was at phase training. I won. You're not going to believe that. So take a guess. How long in years have we been treating trans individuals in America with hormone therapy? I love the brave first answer. Thank you for submitting that. Now, with Price is Right, everyone, you should understand you need to go over or not to go under, just so you know. That's how you win at Price is Right. So I got 35 years, I got 30 years. Are we gonna go higher or lower on this? 20 years, so that'd be 2004. 25 years, 1999. Doing quick math in my head. It's not like that hard, but I'm doing it. Any other answers? I'll let us taper off after this sentence. So I asked this question and I've been doing it since the start of the first training I ever gave. And that was in 2014. It was 10 years ago now. And the answers I've got have always been pretty consistent. And that is between 10 and 20 years is what people will tell me. That is the most consistent answer that I get. Occasionally I get 5 years. Sometimes I get 50, sometimes I get 30. Very rarely do I get the correct answer. The correct answer is 70. We've been doing this for 70 years in America, and it started with Harry Benjamin and Christina Jorgensen. That was like the father of hormone therapy in America. That's the story of that. And his research that he did in the 1950s with treatment on Christina Jorgensen then became the true transsexual model in 1966, which is the first guideline of treating trans people. 1966, that was the first guideline. That guideline became the Standards of Care in 1979, and the Standards of Care put out by WPATH. The Standards of Care in 1979, Edition 1, became the Standards of Care version 8 that got released in 2021. That Standards of Care version 8 took 5 years to put together by 119 medical experts featuring over 1,500 citations. There is so much misinformation that suggests that trans care is experimental or new or based on like 4 studies that is so effortlessly provably false. I have been doing a lot of research into this my entire life, pretty much, because I am a trans person. Like, I had to do the work because no one was doing it in North Dakota when I was growing up. So when I look at it as both someone who is trans and someone who got into medical care from an administrative nonprofit lens, not as a doctor, but works with doctors, it is hard for me to understand that people think that there would be a malicious component to trans care where we are trying to force trans care without medical efficacy to it, that we aren't trying to do the most harm reductive things possible, that we're trying to make sure patients have the best outcomes and quality of life. Like, why would healthcare do anything else? Why would doctors do anything else within the litigious field it can be to be a doctor and practice medicine? The idea that this is not good care is hard for me to respond to sometimes because of all the effort I see that is put into making sure we have the best outcomes. And I've seen historically the treatment, it has been baby steps from the 1950s. When we first started doing it, we had all those concerns that we hear about today, which is like, if we give a man estrogen, won't that just kill him? Like, that was questions we had in the 1950s. Like, and we really slowly figured it out in the safest way we possibly could. Treatment for youth in general is more modern. We didn't have that starting out, but even in the 1990s, it started to be common practice where there were guidelines built around it. So that's kind of the history of it. I think it's worth talking about because usually when we talk about this, there's so much national discussion right now filled with a lot of disinformation and misinformation about all of these things. And I really want you to understand kind of how some of these conversations have formed. What you're seeing, right, I think I get closer to it. No, I guess I don't. What you're seeing right now, here's a question people have. Are kids getting tricked into identifying as LGBTQ plus, or more specifically trans? And more specifically, are young girls getting tricked into wanting to identify as boys is probably the emotional center of those conversations and questions people have. That was based on something called the Rapid Onset Gender Dysphoria study that was done in, I think, 2017 by, I believe, Littmer or something like that. Anyways, the data with that, when we actually investigated it, we found that the age of difference between a youth being like, I think I'm trans, and actually going to a clinic to get treatment tended to be between 2 to 3 years on average. And when we look at this, this is the 2 down here. This is 2 to 3 years, and this is 3 to 4 years. That's how it's broken up. So technically speaking, it's closer to 3 years as an average, meaning that kids aren't looking at YouTube and seeing a trans star and going, oh, that's going to be my life from now on. They are often internalizing this with a big struggle. And the way it works out for these kids is typically this. They recognize that they're different for a long time. A lot of kids do, not all of them. And then they are terrified of the consequences of being different. Trans kids are not stupid. They do not think life is sugar and candy for trans people. They see and recognize the abuse that we see nationally and locally, the ostracization, all the stories about that trans swimmer. They see that. They understand that. And if their parents are talking about it at home, they know where they are safe and they know where they are not. So they avoid talking about this because they are terrified. So what do? They talk to their friends about it. They talk to people they do feel safe with, often other trans or gender diverse youth, and they talk to them and go, this is what I'm going through. And that's how it's happening. And the other kid is like, yeah, no, I get that. That sucks. Like, we'll get through this. And they get support from another 8th grader. Like, that's their emotional support. And then they come out to their parents and they're like, hey, mom, hey, dad, this is what's going on. This was going on with me, and this is what's happening. So that's what happens for these kids. Here's what happens for the parents. They assume their kid is straight and cisgender and not trans. Every parent assumes their kid is probably straight and cisgender. They don't really question if their kid is gay or trans. That is something the kid has to tell them. Not all homes, but most homes, that's what's happening. So parents assume this. So then they see their kids hanging out with other LGBT plus youth or having LGBT plus friends. You know what happens? They're like, why are they doing that? Why is my normal kid hanging out with those kids? What's going on there? And then their kid comes home and goes, I'm a gay kid too. And the parent goes, what's going on here? Why do you think that? Is it because you're hanging out with those other gay kids? Did they make you think that you're gay? Did they make you think that you're trans? Is that what happened? That's why this happens. That's why we have this moral panic, is because that's what the parents see. They don't see the struggles a kid went on for years. They don't see how their language could impact their kid feeling safe or not at home. And much like with the AIDS pandemic, the language we hear about trans youth today is irreversible, damaging, uh, chemical castration. Like, we hear these really scary words applied to trans youth in medical care that makes parents terrified that their kids are going to make the wrong choice and die. And then when their kid says, hey, I'm trans, it's not, okay, let's figure this out. Let's have a conversation. It's, I need to stop this behavior because it's wrong. That's how rapid onset gender dysphoria was created as a study. It was not asking kids, it was asking parents from forums where parents were really scared about their kid. And I think that the fear is valid in the sense that it is a scary thing, but the way it gets applicated is not healthy for our population or for the youth. When we look at science, the through line of it is that developmental psychologists have found gender identity develops around age 3. We all have one is the consistent between cisgender and transgender kids. There is so much to the science that I'm glossing over in this 1 hour presentation, but I really want to say that WPATH is the place to go. I used to have all these citations and studies that I would talk about, but since WPATH came out in 2022, actually, I think I misquoted that, that's the place I refer to. And I just want you to know that there is so much research into this, that detransition is very rare, that there is a biological origin to this, in that you can see that both with with identical twins, as well as looking at brain structures like the bed nucleus stria terminalis. There are so many ways we can look at neurologically and developmentally that show that this is not just a contagion or an idea, but naturally how people are. And the best proof to that is not a medical argument. It is, why would you ever identify as trans in North Dakota if it was a choice? Why would you ever transition in North Dakota if you had a choice? There is no privileges to it. There is only consequences to it. There is only your life gets worse. So what does it actually feel like being trans? And this is going to be like the last exercise I have. I know that we're almost getting to the hour already, but this is the thing I really want you to know about, and then what I wanted to build into. I want you to close your eyes. I want you to put your hands in front of yourself, and I want you to clap without your hands touching. This is the exercise I want you to do. And I hope that you're thinking to yourself, how can this explain what it is like to feel trans? But it will. So put in the chat right now, if you know, why can we do this? Why can we close our eyes and bring our hands close to each other without them touching? Why do we have that sense? Why are we capable of doing that? I'll just give you a couple seconds to think about that. I forgot to name the winner, by the way. If anyone recognizes that they had won the decade challenge, give yourself that trophy. Like, you earned it, and let people know that you're the winner. So to move on quickly with this one, and not give you more time on it, proprioception is the reason we can do it. There's a sense in our brain that allows us to know where our body parts are in relation to each other. But you don't have to think about that most of your life, right? You just are able to naturally walk about and go through your day. So let's think about a sense that you don't normally engage with, and that's your sense of balance. Think about right now the last time you thought about your sense of balance. When was the last time you thought about it? and what was happening at that time. And then I invite putting another thing into the chat if you would want to share something about that. It is icy, so there is a, yes, good job, Jenna. It is icy, so there's a free answer to that. But when's the last time you thought about your sense of balance? Do you even remember the last time you thought about your sense of balance? For some of us, it's a bigger issue. Some of us, it's every day, getting out of bed, going in the shower, walking on ice, especially as we get older. I always caution our elders. I know how terrifying it can be to fall on the ice. For a lot of us, we don't have to think about it though, right? And we don't have to think about it because we're in balance. We're not falling over. We can just, right now we're being entertained by whatever I'm saying, but we don't have to think about that sense. But it's there. And when we do think about it, why? It's because something's wrong. We're falling, we're tripping, we're getting off balance in some way. But here's something that can happen. If you're on a ship and you're off balance for long enough, you feel motion sickness, which is actually debilitating. Like you can't function while being motion sick. Maybe you can. I can't power through that. I can power through a lot of things, but motion sickness, I am a baby. I am in bed. I cannot deal with the world. So I want you to think about this as a big idea. We all have a sense of balance, but you probably didn't think about it today. Maybe you couldn't tell me when you thought about it 2 months ago, but we have it and it's important. And when it goes wrong, it can be debilitating. Gender identity is the exact same thing. If your gender identity has always been congruent to how your body is developed, you're not going to feel it. It's just comfortable like your balance is. However, if something is wrong, you are going to feel it in the same way you can feel off balance. You're going to feel it in the same way where you feel discombobulated. And just like being motion sick, you are going to be debilitated because your body feels so wrong in the same way you can feel jet lag. And that's what it's like for someone who's trans. When someone transitions, they're not trying to prove what a woman is. They're not trying to reclaim these power structures, all these big ideas and philosophies you have. They're trying to be comfortable in their body and then communicate themselves to the rest of the world in a way they can continue to be comfortable and in balance. That is what it is to be trans. Every person transitions for different reasons and has different needs, but it's always about balance and feeling like you have balance in your life. That is what it is to be trans. There is nothing bigger or smaller than that. It is finding balance. We're coming to time now, so the questions I have for peer reflection, this is something to talk to your peers about, and that is, it's tough to talk to someone who is an expert at these topics who also has a lot of personal experience with them. You don't want to say something wrong or offensive or feel like you don't know what you're talking about. So talk to people you do feel safe with. Talk to them about the training today and talk about, does the data I presented conflict with previously held beliefs? Why is there so much misinformation out there? And what new thing did you learn that was helpful and interesting? You cannot become an expert by listening to me for an hour, but if you put more time and investment into this, that pays off in dividends. If you care about this and continue to try to be better, you can make your clients feel safer with you and just become great at this stuff over time. If you need any help or resources, if you're not able to attend other trainings I do, you're always welcome to reach out to me. I will be doing this work for my life in North Dakota. As a kid who barely survived growing up in the state, it's my life mission to make sure other queer youth have hope, have opportunities, and that I can really make an impact on the suicidality in our state. So I am always there to help in any way I can in a non-judgmental lens. Like whatever you email me, I'm going to try to help you. I don't care what language you have access to or knowledge you have access to. Try to make it sound like a question and I will answer it, is kind of what I promise. So that's my first training. Hopefully it excites you for the other trainings I can get into. And I really appreciate all of your time today and wanting to learn more about all of this. But I think that's exactly my time.